So one of the most common questions we get is it safe to strength train if we have high blood pressure? And it's natural to be concerned about spikes in blood pressure when we do resistance training. When we squeeze our muscles and contract them and deliver a high effort, our blood pressure will go up in that moment. And your instinct might say, well, if I have high blood pressure, I should avoid that. Let's think about another example of something that goes up during exercise and why it's not scary for that thing to go up. And in fact, it's beneficial. And then we can understand why it actually might not be such a big problem for our blood pressure to rise. The example is our heart rate. It's not good if we have a high resting heart rate. We want a low resting heart rate. That's a good indication of our cardiovascular fitness. If our heart rate is beating slowly, not very slowly, indicating something wrong with our heart itself or the signal conduction in our heart. But if we have a heart rate that's 50 or 60 beats a minute, right, that is sort of indicative of good cardiovascular capacity. Our heart is not having to beat very hard in order to meet the demands of the body at rest. If our heart is racing at rest, it means that it's just really struggling to keep up with even the lowest level of demand from the body. And that means that if we did suddenly have to generate a high level of effort or output from exertion to run and catch a train or help pick somebody up or whatever, our heart would struggle to meet that demand. So we want to elevate our heart during exercise as a way of lowering our resting heart rate, right? If we do exercise that raises our heart rate, that will result over time in adaptations in the body, enzymes in our cells, red blood cells in our bloodstream, all these different adaptations that will improve the cardiovascular capacity of our body, or the efficiency of our body to deliver oxygen and remove carbon dioxide from our muscles. And that in turn will mean that our heart doesn't have to beat as hard or as fast at rest to meet the needs of our body. And so in the same way that raising our heart rate with exercise lowers our resting heart rate, which is a good thing, raising our blood pressure during exercise can actually lead to beneficial changes to our circulatory system at rest. So there's plenty of research on this, and I've written about it in my most recent article, that when we elevate our blood pressure with exercise in pulsatile fashion, meaning for a minute at a time here, a minute at a time there, we see these increases in pressure, that signals to the body that we want flexible, pliable blood vessels, which can absorb these increases in pressure and which then become better at absorbing increases in pressure later. And that's what we want. We want flexible blood vessels that can absorb the pulses of our heartbeat. Because if our blood vessels become stiff, then what happens instead is that all of the increase in pressure that every heartbeat produces gets transmitted out to the small blood vessels in our brain, in our eyes, and our fingertips and toes, and that creates stress on those smaller blood vessels. So strength training accomplishes this for us by tactically, precisely, therapeutically increasing our blood pressure for a few times a week during exercise. We can actually cause beneficial changes in our circulatory system that will then lead to healthier blood pressure down the road, not to mention the fact that strength training, improving our metabolic health with strength training, leads to a lot of benefits with respect to our insulin sensitivity and metabolic health and fitness. And that in turn has been shown clearly to lead to a lower blood pressure because many of the things that drive our blood pressure up have to do with declining metabolic health, rising insulin levels, and things like that. So it's an understandable question of why do we feel okay allowing our blood pressure to go up during exercise, but there's plenty of evidence to suggest that provided that we avoid extreme increases, we're not going to do one repetition max efforts where a person's bench pressing a super heavy weight if they have dangerously high blood pressure. But for a person who has mild hypertension, 130, 140, maybe even 150 systolic over something like 80 to 100 diastolic, being smart and loading our muscles with moderate weights that we can handle comfortably for a minute or two, a couple minutes. If we can handle the weight that long, it means it's not too heavy for us. And then doing that in a periodic fashion will allow our bodies to actually form beneficial adaptations that can lead to lower systolic and diastolic blood pressure over time. So it's a good thing to do. We just want to figure out a way to be safe while we do it, but we should be confident that it's actually a net benefit and not something that's hurting us when we do it.